Migraine headaches are a neurological condition that affects approximately 1 billion people worldwide. Migraines are more common in women than in men, with around 18% of women experiencing migraines compared to 6% of men. Migraines can be triggered by a variety of factors, including stress, hormonal changes, certain foods or drinks, changes in sleep patterns, and sensory stimuli like bright lights, loud noises, or strong smells. Migraines are typically characterized by a severe, throbbing headache that is often accompanied by other symptoms such as sensitivity to light and sound, nausea, and vomiting. Migraines can last anywhere from a few hours to several days, and can significantly impact a person's quality of life. There is no cure for migraines, but there are several treatments that can help to manage symptoms, including medications, lifestyle changes, and alternative therapies. It is important for people who experience migraines to work with their healthcare provider to develop an individualized treatment plan that takes into account their specific symptoms and triggers. Migraine headaches can be classified into two main categories: migraine with aura and migraine without aura. Aura refers to a set of symptoms that occur before the onset of the headache, such as visual disturbances or tingling in the limbs. Migraines can be hereditary, meaning that they can be passed down through families. People with a family history of migraines are more likely to experience them themselves. Migraines can be a disabling condition, and can have a significant impact on a person's ability to work or carry out daily activities. There are several different types of medications that can be used to treat migraines, including over-the-counter pain relievers like ibuprofen and acetaminophen, as well as prescription medications like triptans and anti-nausea drugs. In addition to medication, lifestyle changes like getting regular exercise, practicing stress reduction techniques, and avoiding trigger foods and drinks can also help to prevent migraines. Women may experience migraines during pregnancy, menopause, or during their menstrual cycle due to hormonal changes. Migraine headaches can increase a person's risk of developing other health conditions, such as depression and anxiety. Migraines can be diagnosed through a combination of medical history, physical examination, and diagnostic tests, which may include imaging tests like MRI or CT scans. Migraines can be associated with several comorbid conditions, including fibromyalgia, irritable bowel syndrome, IBS, and chronic fatigue syndrome. Chronic migraines are defined as migraines that occur on 15 or more days per month, and can be particularly challenging to manage. In some cases, migraines can be triggered by changes in weather patterns or barometric pressure. Migraines can occur at any age, but typically onset in adolescence or early adulthood. Migraines can be a significant financial burden, both in terms of direct medical costs and indirect costs like lost productivity and missed workdays. There are several different complementary and alternative therapies that may help to manage migraines, including acupuncture, massage, and herbal remedies. In addition to traditional pharmacological treatments, there are several emerging treatments for migraines, including neuromodulation devices that stimulate specific nerves to reduce the severity and frequency of migraines. Some people with migraines may benefit from cognitive behavioral therapy, CBT, which can help to reduce stress and improve coping strategies for managing migraine symptoms. Children can also experience migraines, and may exhibit symptoms like abdominal pain, dizziness, or vertigo in addition to headache pain. Migraines can be associated with several risk factors, including a history of head injury, sleep disorders, and certain medical conditions like high blood pressure or obesity. While migraines can be a challenging and sometimes debilitating condition, there are several resources available for people with migraines, including support groups, advocacy organizations, and educational materials. Migraine research is ongoing, and new advances in understanding the underlying causes and mechanisms of migraines are continually emerging. Migraines can be accompanied by a wide range of symptoms, including fatigue, difficulty concentrating, and changes in mood or behavior. Migraines are often more severe and debilitating than tension headaches, which are another common type of headache. Migraine headaches can be a symptom of an underlying medical condition, such as a brain tumor or stroke. However, these conditions are rare and typically present with other symptoms as well. Migraines can be triggered by environmental factors like exposure to chemicals or pollutants, as well as changes in altitude or time zone. In some cases, migraines can be triggered by certain medications, including oral contraceptives and blood pressure medications. Migraines can also be triggered by certain foods or food additives, such as caffeine, MSG, and aspartame. Keeping a headache diary can be a useful tool for identifying potential triggers and patterns in migraine frequency and severity.